800 women die every day due to preventable pregnancy-related causes and delivery. Hey everyone, welcome and welcome back to the Ladies Corner with Dr. Lizzie. On this channel, we discuss everything women, from health to relationship to entrepreneurship, parenting, and lots more. So today we will be discussing on the danger signs of pregnancy. Yes, as we all know, pregnancy is a remarkable journey filled with joy, excitement, and anticipation. However, we must acknowledge the fact that it comes with potential risks and complications. As an expectant mom, being aware of these dangers is crucial for a healthy pregnancy, a safe delivery, and a happy outcome for both mom and the baby. Why are we discussing about this topic? The importance of this topic cannot be overemphasized. According to a study by World Health Organization, almost 800 women die every day due to preventable pregnancy-related causes and delivery. Hence, it is important that every woman becomes enlightened, her spouse and also relatives around her about these dangers in pregnancy, so that immediate and appropriate action can be taken to reduce maternal mortality and also fetal mortality. When you see these dangers, please do not hesitate. Don't say you want to wait till tomorrow. Rush to the hospital. One is vaginal bleeding. Vaginal bleeding is common in pregnancy, and this does not always mean that there's a problem, but it can be a very dangerous warning sign. Pregnant women can bleed in pregnancy for different reasons depending on the stage of her pregnancy, either first trimester, second or third. Now, causes of bleeding in first trimester: one is implantation bleeds. This is also called spotting. This implantation bleeds occurs very early in pregnancy, usually 6 to 10 days of pregnancy, and this is because the fertilized egg is attached to the lining of your uterus, that is your womb. This does not mean a problem. Now, another cause is threatened miscarriage. Now, threatened miscarriage does not mean you've lost the pregnancy, but there is tendency for you to lose the pregnancy if immediate and proper intervention is not taken. Then another cause is miscarriage, ectopic pregnancy. Now, ectopic pregnancy, this is when your pregnancy is developing outside your womb, that's the uterus. Now, causes of vaginal bleeding during the second and third trimester, that is from 14 weeks upward. Now, one is late miscarriage, two is placenta previa. Now, placenta previa is when the placenta gets implanted or gets attached at the lower part of your uterus, covering some or whole of your cervix. And another is placenta abruptio or placenta separation. Now the placenta is the part, or let me call it like an organ that connects the baby to the mother. And this is where the mother gets, the baby gets all its nutrients from the mother. If the placenta is some part of the placenta that is separated from the mother, this means that the baby cannot get all the nutrients that it needs fiber. And also, vaginal bleeding during pregnancy will mean that you are having a premature labor. That's if it happens less than 37 weeks of pregnancy. Also, it will mean that you are going into labor if this happens later on in the pregnancy, which is it is also called show. So when you see this danger sign, please do not say you want to wait till tomorrow. Rush to the hospital, because this is very dangerous. Another dangerous sign in pregnancy is convulsion or fits. It is also called eclampsia. Now, eclampsia is a complication of preeclampsia. Now, what do we mean by preeclampsia? This is when a pregnant woman's blood pressure is high and also there is protein in her urine. Now, convulsion, this like sometimes you see a woman having a jerking movement. So this is what we call as eclampsia, and it is a very dangerous sign, because if proper intervention and immediate intervention is not taken, this woman can go into coma, she can have brain injury, she can have stroke, and even lose the baby and also the mother as well. Another dangerous sign in pregnancy is change in the movement of your baby. Now, there is no set number of movements you should feel. Every pregnancy is different. So every expectant mom should be aware of the pattern of the movement of her baby, so that when there is any change, she will be able to identify it. Now, when there is reduction increase or no movement of your baby, this could mean that your baby is unwell. The fluid that's called lipo around your baby is not enough, or there is high risk that you're having a stillbirth. So this is a very serious danger sign that when you experience that, please go to the hospital. Another danger sign is severe headache. Now, the headache is very severe. It's sudden, it comes sudden, and sometimes does not even go with medication. And some women explain it as a thunderclap headache, or the worst headache in their life. And sometimes there could be blurring of vision when you can't see things clearly, or you're seeing double. That is a very serious danger sign. This could mean that you are having preeclampsia, which need immediate and close monitoring. So please go to the hospital. Another warning sign is hyperemesis gravidarum. Now, hyperemesis gravidarum means excess vomiting. Vomiting in pregnancy is normal. This is usually called morning sickness. But when it becomes excessive, that a woman cannot keep something down her stomach, lead to dehydration, imbalance in your electrolytes. And when your electrolytes are affected, when there's imbalance in your electrolyte, this can affect a lot of function in your body. So this is a serious sign. Do not take it lightly. Now, another warning sign is shortness of breath. Now, it's normal for a woman to experience shortness, that's decrease in your breathing, especially during the third trimester. And this is because of your growing uterus. So it makes it difficult for the lung to expand as it should. But when shortness of breath becomes sudden with chest pain and tightness sometimes, please, this is a serious warning sign. Do not take it lightly. Now, these signs are not all, but this is just few from the common danger signs in pregnancy. If you experience any of these signs, please do not take it lightly. Do not hesitate. Do not say you want to wait to observe or wait till tomorrow. Please rush to the hospital in order to save yourself, to prevent harm to your baby, yourself, and have a better outcome and a happy outcome for both you and your baby. If you find this video helpful, please, why not share it with somebody? And also don't forget to like, comment, and subscribe to keep updated on our latest content. Thank you, and see you next time.